Welcome to the Lead Change podcast. I'm your host, Dr. Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of leaders. On this podcast, we will share stories from physicians in various medical specialties and those in roles that support the advancement of medicine to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome everyone to the Lead Change podcast. I am so excited to have my good friend and colleague, Dr. Kling, on the podcast today. Dr. Kling is a professor of medicine, chair of the Division of Women's Health Internal Medicine, assistant director of the Mayo Clinic Women's Health Center, and dean of the Mayo Clinic Alex School of Medicine in Arizona at the Mayo Clinic in Scottsdale. She completed medical school and a master's in public health at the University of Arizona Tucson and internal medicine residency at Mayo Clinic, Arizona, followed by a chief internal medicine year. Her clinical and research interests are in menopause, sexual health, LGBTQ+ care, education, as well as efforts to expand the discipline of sex and gender-specific medicine. Dr. Kling is recognized as an institutional and national expert and leader in menopause. She speaks at national and international meetings on topics related to menopause and hormone therapy and has published extensively in the field. She is a Menopause Society certified practitioner, a fellow and board member of the International Society of the Study of Women's Sexual Health, and board member of the American Medical Women's Association Sex and Gender Health Collaborative. Jewel and I are both participating in the Executive Leadership in Academic Medicine, or ELAM program this year. We first met in June 2025 when we were put together in our learning community, which is a very small group of ELAM fellows who work very closely together throughout the year-long program. I have really enjoyed working with and getting to know Jewel over the past several months. I'm looking forward to having a discussion about her leadership roles, the experience she has gained, and how she has carried that forward in her career. Jewel, welcome to the podcast. Thank you so much for being here.
Mary, it's an honor to be here and I'm so excited.
Awesome. Well, let's dive right in. So before we touch on some of the really more specific leadership aspects, I wonder, can you tell us a little bit about your clinical practice and just highlight some of your the biggest interests that you have in your areas of expertise?
Yeah, that's a great question because most people hear women's health internal medicine and they're like, what is that? Most people think women's health is gynecology and internal medicine is something else. In our practice, what it looks like is really a hybrid model. I have the privilege of providing primary care, mostly to cisgender women, but some cisgender men, as well as transgender and non-binary folks. And then I have opportunity for consults in the area of menopause and hormone therapy, sexual health, and then I work in our high-risk breast clinic. So that's what I do in clinic, and my research interests are all around those same areas. You probably heard in the introduction my dedication to focusing on sex and gender-based medicine, and it's really the idea that men and women are different. And for most of medical research, we didn't focus on looking at those differences. In fact, most of research was done in men and applied to women. Now we have this opportunity to really learn about all these different things between us by looking at those sex and gender-based differences. So they kind of go hand in hand, the research with the clinical practice.
Yeah, I love that. And I think it's so important. I love that you brought up that point too, that you're really focusing on sex and gender-based differences, and that men and women are different, shocker, but yeah, from research perspective, right, that it's absolutely critical. And in orthopedics even, right, we are so focused on where should I put the ACL tunnel and how should I do this knee replacement. But even in orthopedics, right, in the past 5-10 years, we have also really acknowledged the critical differences between male and female patients and outcomes and how we should be treating them, and just really looking at those differences. So it's fantastic that you're doing that within your own research. I try to make that a priority too in the research that I do. But I think bottom line is, I think across medicine, we are really recognizing that it is important to look at this and that we clearly separate out our male and female patients, that we look at the results differently and not just say, well, I had 100 patients, 60 men and 40 women and combine the results. results. We shouldn't do that. And I think, I know when I'm reviewing papers, and I'm sure you too, like I definitely make a point to say, please separate out these results and give us the breakdown and what were the outcomes based on your, your male and female patients.
Yeah. 100%. And the reality is there might not be a difference, but we only know if we take a look and if we disaggregate that data by sex. Of course, the pushback is that's more expensive. You have to be powered to do those things, but we're really moving in the direction of precision-based medicine where we can tailor our treatments to patients based on things like genetics and such. These basic principles of sex and gender, I mean, we should know those, right, when we're studying different things for them.
Yeah, absolutely. So that is fantastic. And I can't wait to see how your research evolves. And we'll definitely have to keep that conversation going.
Yeah, 100%.
So you have served in several very important leadership roles, like even as early as medical school. And I think that's fantastic. So you mentioned to me that you served as the national leader for the American Medical Student Association, that's AMSA, while you were in medical school. So congratulations. That's amazing, right? You. Not many medical students are pursuing leadership roles like that in that period of your career. So for everyone listening, can you explain to us what AMSA is and what your role as the national leader really entailed?
Yeah, I would be happy to. And if you would indulge me, I'd love to give a little bit of background to what led me to that.
Perfect.
Because I think that lays the groundwork for why I was interested. When I think back about why am I a leader, I was really called to do that based on seeing the experience of both my parents being active in their community. Mom was a therapist for victims of sexual assault, and my dad was a homicide and sex crime detective, and both worked a lot around anti-violence efforts. And I saw just how important it was to work on things that mattered and represent communities that maybe you're not part of. One example here is my dad went and gave a talk to an LGBTQ community about hate crimes and ways to reduce it. And it was the first time that it dawned on me that you don't have to be part of a community to advocate for that community. And so I was inspired by them to do a similar thing. And when I looked around and saw people in the community, I saw that physicians were looked at as leaders. Even if we don't think we're leaders, what we say matters and what we do matters. And so got it in my head at a young age that I wanted to go down that path, not just to help people. I mean, that's a really incredible part of our job, but also to be a voice for people that didn't have a voice, really fueled by my parents' community-based work. So when I got to undergrad, that meant that I did a lot of work around anti-violence work and advocating for communities like LGBTQ people, and recognized that I needed some additional training and wanted to get some experience in policy and public health work. That's why I did a master's in public health during my medical training. So when I got to medical school and learned about AMSA, which is like you said, the American Medical Student Association, I got really excited because the whole idea behind AMSA is that it's student run and student driven, and it's meant to teach you the things that you don't learn in medical school. Because when I looked at my preclinical curriculum, I didn't see a lot of how to advocate for health policy that's going to impact health disparities. That certainly was more focused on in my MPH, but I had to seek that out. So raised my hand. Yes, I want to be involved with AMSA, first locally, and then going to the meetings, met the other people just like me around the country that were really passionate about advocating for their communities. And so ran for the gender and sexuality chair, which was a national position. And what was super cool, at least at the time, and I don't know if they do this now, we would have meetings every month in DC, well, in Reston, Virginia, but very close to DC with all the national leaders. And I loved being close to the action. And more than that, seeing that as a medical student, your voice and what you shared really mattered. We would organize these big national lobby days where we would have people come in, medical students from all across the country. And I would be calling all the legislators to set up meetings with these students. And we would bring things forward, advocate for legislation that could truly help our patients in ways that maybe you just don't have the ability when you're working one-on-one. And so it was a tremendous experience. I still am connected with so many of those AMSA leaders. They call us us oats, old AMSA types. Yeah. And it I don't know, it reinforced my interest in being a leader. And maybe am not as involved in policy, and I can talk more about that, why that experience landed. But I'm grateful for both the connections with the people that were so passionate about similar things as I was, but also just the experience of being able to lead early on in my career.
Yeah, wow, that is tremendous. I had no idea. It's so incredible to hear about that experience and the impact that it's had on you, and also just unpacking a couple of points that you made, and there were so many, but a couple to highlight. One, that as physicians we are all leaders, right? We are all leaders regardless of whether you have an official title, and I think that that point is so critical, and certainly something that I hope that we share repeatedly on this podcast, is that just being a physician, you are looked at as a leader. You're a leader in the clinic, for me as a surgeon in the operating room, but in the community, in all these interactions, you are looked at as a leader, whether or not you see yourself as a leader necessarily, but you are a leader for sure. And so gaining skills through these different roles, through hopefully things people are learning from this podcast, but learning from other people you interact with, I think that's absolutely critical, because that point you made is so true. And then another point, and I loved to hear about your dad giving that talk, I think, but the key point there is that we can all help advocate and support and promote and sponsor people who are not necessarily like us or look like us or are in the same group. And within orthopedics, and I'm sure similar in internal medicine, right? We have different specialty groups or different focus groups. So for example, there's Pride Ortho, there's the J. Robert Gladden Orthopedic Society, which is largely our African-American Black colleagues, and then Ruth Jackson Orthopedic Society, which is a lot of women in orthopedics. But anyone can become a member of any of those groups, right? And so I think that that's key. And so many of our colleagues, whether or not you specifically identify with that group, are members to support and promote and advocate, just as you were saying. And I think that's really a critical point, and I love that you brought that up.
Mm-hmm. Yeah, I mean, it's the good for the community. If we raise everybody up, it benefits us all, right? And sometimes some of us have privileges that other don't. I maybe still get a little nervous giving talks, but not like some of my other colleagues. And if I can get out there and share information that's important for people to hear that they wouldn't have otherwise, then I'm going to do it, not because it's me, but because it's creating a space to talk about things that maybe other people can't. And similar to what you're talking about, getting involved with those organizations can go a long way.
Yeah, absolutely. So important, right? And we are all taking care of patients from every background, every,
Right.
gender diversity, racial, ethnic, like sexual identity, right? We are all taking care of all these patients. And so the more we learn, the more aware we are, the better physicians, the better we are at being physicians and surgeons and just taking care of our patients. So I love that. What are some of the most valuable lessons, so as you break down your time and your role in AMSA, what were some of the most valuable lessons that you learned, and how have you carried that forward in your career?
I think, we've touched on probably the biggest ones I took away. And probably, I mean, going full circle, I've been in this dean role for our Mayo Clinic Alex School of Medicine for about 3 years now, and was attracted to working with medical students because I got to experience how powerful it is to be a medical student. Like, I remember at times thinking, oh gosh, I'm not contributing to this team, or I really don't know this well enough like the experts. But the reality is you matter, and what you bring to the table matters, and so much information that it was very empowering being in that role and learning that I could have such an impact even so early on in my career as a medical student. The other part was, which makes me reflect on ELAM actually, is being around people that share your passion for things can be so invigorating. I was doing this leadership role while I was in medical school and busy between step studying and doing clinical rotations, but it wasn't exhausting. In fact, it like filled my cup because you were seeing people that were so passionate, and it gave you hope. And so I just encourage people to spend that time finding your community, and doing this type of work doesn't necessarily have to be exhausting. It can renew you, so you show up to clinic a little bit differently, or you show up to your family a little bit differently, with more hope and energy.
Yeah, that is an excellent point because I think people say, and probably people say this to you all the time, Jewel, how do you do all of this? Like, how do you have enough time? How do you balance or juggle these things? But the point that you made is so important in that, even in medical school and things you do now, right? This role, like in AMSA, was invigorating. It was inspiring. It gave you energy and motivation and inspiration to pursue the other activities and to be able to do that, to kind of approach that with renewed energy. These things it's not work, like you love it and is empowering. And I think the energy component is really key that you touched on. So,
And I might just say one other thing.
yeah, please.
It's always helpful looking back because it becomes so much clearer. I can remember in medical school not being, very clear of exactly what I wanted to do with my career. At one point, thought peds, and then learned about internal medicine. And then coming to women's health internal medicine was this very windy road. But I can track it back to experiences that I had with that team, with the people, and how they influenced me. I remember one of the other AMSA leaders who was on the education committee talked about how we can't take for granted that we can teach. That's the assumption in medicine, is that because you've gone through medical school that you're going to be a good teacher. But there's so much more that goes into education and medical education that it's important for us to invest in building those skills, doing that faculty development. Hear that all the time. I mean, that person sticks in my brain, and that led me to pursuing those type of things. So it all matters.
Yeah, it does, and it's incredible how something so early on in your training and career can have such an impact throughout your career, like into your practice, and you still think about these things and recognize how it has influenced you. So I love that. You currently serve as chair of the Division of Women's Health Internal Medicine at Mayo Clinic, Arizona. So as you stepped into that role, what were some of your main goals?
Well, I stepped in a little bit unexpectedly, not thinking it was my time to step into that role. But the opportunity arose, and my chair was retiring, and I became the interim chair. That was right before 2020. And everybody listening knows what happened in 2020. So when COVID hit, I was still interim chair. But when everything's kind of taken away and you need somebody to step up and lead, that was probably the most empowering experience, because I didn't have time to doubt my abilities or my skill, or if I was prepared. I just knew I had to be there to represent my team and my patients, and it gave me the opportunity to step up in a way that I didn't think I would have at that stage in my career. So it was really empowering, and I leaned into it and saw how incredible it can be if you have a passion for your team and for what you do, to affect change. One of the big tasks we had to do was figuring out our future direction as a division. There were discussions about whether or not we should be absorbed into another division, or if we should continue to grow, if we should do more consults than primary care. And so it was a wonderful challenge to be presented with, especially at a time during COVID. But I had wonderful collaborators with our leadership team, with our administrative and nursing team, and learned so much, especially in those early years. I'm about 5 years into that role, and certainly feel a lot of confidence from doing it for that amount of time, but look forward to all the other opportunities and challenges that come along with it.
Yeah, that's really amazing. And I think something that maybe others listening can appreciate or have experienced, but you were given this opportunity and you didn't expect it. You didn't see it coming, but then you embraced it, and it was a challenging time for sure. 2020 was a very challenging time, but then you rose to that occasion and you worked closely with your team, and you kind of maximized and leveraged everybody's strengths, and learned from each other. And so I think, it's amazing to see what can happen when you're put in a position, right? You may not even realize, right? You didn't even realize what you were capable of.
Well, and I think it speaks to mentorship and sponsorship, and I wonder if that's where you were going, Mary, because the person that encouraged me or tapped me on the shoulder, I think saw something in me that maybe I didn't see at that time. And the other thing, we're doing these leadership interviews for our ELAM, and I'm learning so much from our leaders on our campus. And one of them was telling me, when you're given that opportunity, try saying yes more often than not. Because and when she was sharing in reflection, she's like, every step that I got to, everything that I explored, even if it was a stretch, was such a rewarding and fabulous experience. So I'm so glad that I said yes and I had the confidence and that I had the sponsorship and mentorship from the team both around me, but my previous chair as well.
Yeah, so important. And so a couple things there. I mean, one, the sponsorship, the mentorship, somebody, exactly as you said, seeing something in you that maybe you didn't see in yourself yet, right? But then you stepped into that role and you're like, wow, actually, like, this is working, this is moving forward, this is great. And I think, saying yes to the opportunity is critical. What I like to say too, and for students or residents or whatnot that I mentor, I say, like, if the door opens, don't be afraid to walk through it, right?
Yes,
Just
I
walk
love
through,
that.
go, do it, right?
Yeah,
Just
yeah.
embrace it, take action, and you can do it, you can be successful. So I love that point. I think that's so critical to take away.
One thing that also helped me, and I wonder, talking about this, like when you're uncomfortable or don't know if it's the right thing to do, or you might be feeling self-conscious about saying yes. I started by talking about my why, the things that drive me, and that's something I always go back to. So when I stepped into the leadership position and recognized that leading a division meant that I could advocate on behalf of my team and my patients and the direction of our clinical practice and our research in a way that resonated with that want to advocate for things that haven't been advocated before, just like we talked about with the research, the women's health focus, the sex and gender, like it really all came together. And I was like, yes, this is what I want to be spending my time doing. And what a freaking honor to be able to be doing it?
Yeah, exactly. And I think literally can read my mind, Jewel, because I am not kidding you. That was going to be my next question. Is like,
Amazing.
what drives you? What is your why and your purpose? And you just answered that so perfectly. So I love that, and I think it's just important for everyone listening to understand, like, to try to identify in yourself, like, what motivates you and what drives you, and that sets the tone for everything else. It helps you
Right.
understand, like, what roles do you want to say yes to, right? What fits with your mission and your vision and your goals for yourself, your patients, your career. So that is really perfect.
Yeah, and knowing that North Star can help on the other side too. Like I look to mentors to when I had opportunities come up to say, should I say yes or should I say no, or can I say yes or can I say no to these, to make sure that I wasn't misstepping. But there were some things that I said yes to because I knew it resonated with what was important to why I was doing what I was doing. I was the co-chair of our LGBTI Mayo Employee Resource Group, which was extra time and effort, but it was incredible. And just the impact and the work that we did together was so rewarding. Like we were talking about earlier with the AMSA stuff. And so I knew that was the right thing for me, even though I had folks that said, hey, you don't have to do that. That's not important for your academic promotion. That's not important for your leadership journey. I'm like, yeah, but it's important for me because that resonates with my North Star. So everybody listening, you've got to identify that thing for you and you'll know.
Right. It
Mhm.
will always guide you. That will never, ever fail. And so it's
Mhm.
so fantastic. Like, number one, a mentor or sponsor can't always know if that is that right for you or not. Like, I mean, we look to these people
Mhm.
for their advice and appreciate that and the insight. But then exactly what you said, right? When you're presented with something and you say, this is a great fit. This is exactly what
Mhm.
I'm interested in. And this is going to
Mhm.
fill my cup. And this is right in line with my purpose and my why. And so that really is a great example. Love that. So you also you mentioned this. So 3 years ago, I guess it's 3 years ago, right? You became dean of the Mayo Clinic, Alex School of Medicine, Arizona campus. So huge, huge congratulations. That is so
Thank you.
amazing. What are some of your main responsibilities in that position?
Yeah, so as our kind of regional campus dean, I work with our other deans here on this campus, so our associate deans, the assistant deans, and then help really guide the direction of this campus. I'm also responsible for helping really foster the affiliate relationships with the campuses or the other health programs that our students rotate with, and then looking at kind of big picture vision for our med school, making sure that we continue to lead the way in innovation, in AI, and that we're holding responsible to our Mayo Clinic duty of our workforce. And so working collaboratively with our executive dean and with our other campuses to make sure that we're adhering to that while we continue to train the best and the brightest.
It's incredible. As you became into that role, and now as you've evolved a few years into it, right? What are some of your goals and visions? And have you been able to help move some of those things forward?
Yes, absolutely. A big part of my goal, and which was in line with the Mayo Clinic Alec School of Medicine, was making sure that we were recruiting talent from everywhere, and giving people opportunity to train in a top tier program that maybe historically did not have that experience, and looking for highly skilled folks from many different backgrounds. And we continue to succeed at doing that. The different type of people that come and train at Mayo Clinic Alec School of Medicine, all of our campuses, is diverse and highly capable and just very engaged. And so we continue to invest in that work, and want to make sure that we're training people that look like the communities that they're going to go and serve as well. So another part of my goal, working in conjunction with this amazing team we have here in Arizona, was to provide other opportunities for rotations that maybe historically our students didn't have access to, including in Native health communities and underserved communities. I don't think this will surprise you because I started with this too, but being an advocate for our community and giving back, part of everything that I've done. And so that also included making sure that we had opportunities for students to serve in those areas. We've been working in a St. Vincent de Paul clinic since the med school started here in 2017, and it's embedded into our curriculum. And we've been able to expand that as well as expand other clinical opportunities, including in a street medicine program and some other underserved areas. So that both for the medical school and for the medical students, I think is beneficial, but also really helps give back to the community that Mayo Clinic Arizona is built in, is in the Phoenix community. So,
Yeah.
and lastly, and I know you're going to ask a question, Mary, I really want to address that, but also just to talk about the need to innovate and think differently about how we do medicine. I mean, I think if anything, the last couple of years, starting from COVID and beyond, has taught us that we have to be agile and we have to be able to pivot. And with all of these growing technologies, we have to figure out, both from the ethical side, but then also from the innovative side, how do we incorporate them, especially at an institution like Mayo Clinic, that we want to lead the way in innovation. That's the same what we want to do in our medical school and our education. So making sure we're both teaching students about this so that they can be part of these builders and innovators, but also make sure that our curriculum is innovative in a way that's really bold and unique.
Yeah, such great points, Jewel. And I love too that one of your goals, things you've helped implement, is having some of these, I don't want to say non-traditional, but just outside of the normal curriculum, but having extra rotations, having opportunities to work in student-run clinics, engaging with the community, helping to advocate for the community. That is so important. And the skills that you learn there are really critical and really help you grow as a physician, connect with your patients. So all of that is really, really important for setting the foundation of pursuing a career in medicine. So I think it's fantastic that you guys have incorporated those things and that you're offering all of those opportunities to the students there in Arizona. And I'm sure they take advantage of it. They must love it.
Well, and the more we can build it into our structured or mandatory curriculum, so it's not something that they have to sign up to in addition. Now, there's always going to be the students that do that, but we want to make sure that the students are exposed to treating people from all different backgrounds, because the more we focus on precision medicine and meeting our patients' needs, each patient has unique needs. I'm preaching to the choir here. I know you know this, Mary, but linking the two, right? Like the cultural impacts that you need to understand when you address a patient could potentially impede a treatment plan if you don't recognize that that's what's happening. And so if we can build it into our preclinical blocks or to our clinical blocks, then it's ideal that everybody gets exposure to that.
Yeah, really, really good point, because that's exactly it. You want to make sure that, given how important it is, that all of the students are getting exposure, and that there are probably various ways, as maybe not every student is working in X clinic or doing this rotation, but they all have access to getting similar content. Maybe it's in different clinics, and I'm sure you guys have so many opportunities for the students, but 100% agree with that you want everybody to get exposure in some way, because it's so critical for setting the foundation of being a physician in training, and carries through into your career and really helps you understand how to identify with patients.
Well said.
Yeah. So switching gears a little bit, we mentioned early on that you are participating in ELAM this year, and I'm so glad that we are in the same learning community and have the opportunity to work together regularly. What are some of the things that you've taken away from ELAM so far?
Oh, yeah, that's hard. Like, where do you start? There's so many aspects. I think it's reinforced this idea of community, like the importance of being around like-minded people and seeing that as a benefit, being okay to reach out to that community when you have questions. I've learned so much about some of the more maybe mundane or logistic parts of leadership within academic medicine, about finances, and that's been so powerful, and certainly informed how I've approached decisions, because it's certainly important to have your why and your passion. You need to have the skill set and the knowledge to be able to implement those. And so I think if anything, it's reinforced those really foundational pieces of being a excellent leader, which I've really appreciated. Probably and this is maybe a little bit different than what you were thinking, but I went to residency at Mayo Clinic, and so I've grown up in the system that now I'm leading at, and feel like my Mayo Clinic team is my family. And so it's been really, I think, such a great exploration to work with people that I don't know, and then be tasked with things like our Ann Preston case, where you have to come to the table and figure out how to address a failing health system. I've relied so heavily on past relationships and those things to help guide how I lead. It was a really wonderful experience to be able to figure that out with people that you haven't known in the past.
Yeah, so many good points. And I agree with the first thing that you said, is like, it's really hard to hone in on just a few things, right? We've all learned so much, but that last point too, ELAM starts out with this case, Ann Preston case, and some of you who may participate in ELAM at some point, you'll get that experience too. But I think one of the challenges, a huge challenge with this, was that it's a complicated case, but we're working together with a group of 6-8 people who we've never met, and it's all virtual. And of course, there's a method to this madness, right? So the ELAM leadership, it's purposeful that this is done this way. So we are all leaders, you exceptional leader at Mayo Clinic and working with leaders from other institutions around the country, but then all have to work together, and you've never met. All this is virtual. And so there's definitely challenges inherent with that. But the final product was incredible, and how much we learned from each other and how fun it was to finally connect in person. I think that, that whole experience was incredibly valuable. I agree with that.
Well, and there's probably going to be experiences, the more we lead, that will be in those situations in real life, right? And can reference back to those experiences, and it's just so valuable.
Yeah, no, I agree. I think they're setting us up for sure, especially in our world now. 6 years after the pandemic started, so much is virtual, and we are having to work in teams and make progress and work on initiatives virtually, before we may ever have the opportunity to connect in person. So I do think that was hugely valuable. Also, as part of ELAM, Jewel, so we are all working on an institutional action project. So this is supposed to be something that you're personally interested in, of course, but that will also help your institution. So can you tell us all a little bit about what you're working on for your project?
Yes, of course. And mine may not be very sexy. Not that it has to. I mean, you've just read the description, but it's one of the things that keeps me up at night is making sure that we have enough rotation spots with our affiliates in areas that we don't offer on our campus in Arizona. And I know this is not just a unique experience to Mayo Clinic, that many med schools are facing the same thing, especially those that aren't attached to a clinical campus. But we don't have pediatrics, OB, and some parts of psychiatry in our campus. My institutional action plan is really thinking outside the box about the affiliates, both strengthening the relationships with the affiliates that we currently have relationships with, which have been great, but then looking for other options both within Arizona and in the surrounding area, and then exploring internally within Mayo Clinic, because we have really 4 sites, our Rochester, our Florida, and then our health system. If there's opportunities to allow our students to experience Mayo in different sites and meet our needs in these core rotational opportunities or needs.
Yeah, that's great, and clearly critical to your institution, right? So this is a great project, a great example of what you can do. And you're, having these leadership interviews, you're meeting other leaders in the institution, and all these things hopefully will help that move forward, right? You make these connections, network, develop the relationships, and hopefully make it that much more likely that implementing and finding opportunities for these additional rotations will be that much more successful.
Yeah, yeah, that's exactly it. That's the plan. It's also quite fun. And I've found it working with our team here on the ground, both at Mayo, but then going and exploring other parts of Arizona and meeting folks that are super passionate about medicine, but maybe haven't worked with learners before, and just the kind of unique things they'll be able to teach our students if that works out. So it's been really fun too.
So smart, exactly. Take advantage, work with the community. This is just another way to connect, right? And meet and take care of another group of patients too. So throughout our careers, we work with a lot of different leaders, right? Some that we may connect with a little bit better than others where we may say, well, I don't quite agree necessarily with that style. But, you're working with deans and assistant deans and very high level leadership within the Mayo Clinic. But can you describe for us some of the lessons you've learned from leaders that you admire, right? And what makes them good leaders?
Yeah, hard question, because I've learned so much. I mean, I've learned, I think probably I'm a combination of all of the leaders I can think of, both how they present themselves in meetings, how they interact with our team, how they prioritize what they put their energy to. Always, I mean, I think certainly this finding your why and your North Star has been a critical part of my leadership journey, and something that I've learned from people, from the first mentors I had, my mom and my dad, who continue to make such a powerful impact on my life. Also, the importance of recognizing that we're more than our career, and finding time to define who I am outside of a physician and a chair and a dean, so that I can show up as a mom and as a wife and as a friend and as somebody that enjoys going to shows and exercising and doing all of those things, to make sure that I have all of those parts too. And I've been very grateful to have mentors that have been able to model that as well.
Yeah, that's critical. Such a great point that you brought up too. Like, it's not only, we look to other leaders, other people we work with, we learn from them. We want to learn, of course, leadership skills. Of course, we're extracting that information, but we also, to be a truly effective leader, right? Incorporating these other parts of who you are is also essential, really paramount, and the foundation. If you are not, being a good mom and being a good wife and also taking care of yourself and going to shows and going to the gym or doing the other things that help you, sort of protect your peace, like do some of the other things that bring you joy, you can't be a good leader. Right? You can't be an effective team leader or a dean, right? You're just not going to be as successful in that role if you're not also addressing these other areas. And all of these things together, right? This is exactly what you're getting at. All of these things together make you who you are, right? And so that is truly, that's the authenticity piece, right? You always want to show up as who you are, every part of who you are.
Yeah, because if you don't, I think that's what can contribute to the burnout and just the fatigue, all the stuff that comes along with not at least attempting to find that balance or that integration.
Yeah. 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 I
Yeah,
think exactly it. It's integration. It really is integration. I don't think any of us have true balance. I think it's
right.
impossible to have true balance, but it
Uh-huh.
really is the integration because it's not like you're just a physician when you're, in your office or you're seeing patients or you're doing your research, right? You're still a physician when you're at home, right? And you're still a mom when you're at work and you're still a wife. And so it's really integrating those components, but just making sure that you're keeping all those parts of you in mind. And so I think that's an
Hmm.
important point for everybody listening to take away, that we're not just defined by the physician, by being, an excellent internal medicine physician with the expertise in women's health, or being an orthopedic surgeon. It's not just that, but it's making sure that you're addressing all of these things and that you do the things that bring you joy too. And it helps you just be really effective
Yes.
in all aspects of your career and life.
Yeah, absolutely.
And so I always love to ask, Jewel, I love to ask, what would you define as your superpower? Okay, meaning like, what do you really see for yourself as one of your biggest strengths that truly contributes to your success and helps separate you or kind of set you apart from other people?
Yeah. Gosh, it probably, if you ask different people, they'd say different things about me. But I think probably the biggest is multitasking and efficiency. And I attribute this to having my son right before residency. He was 6 weeks old when I started my intern year, and I decided if I couldn't be with him all the time, which 30-hour calls a couple of times a week means that you're not. Thankfully, I have an amazing husband and wonderful family that was around me. But if I couldn't be there with him, I was going to breastfeed him for a year, which it sounds crazy when I think about it now, but it also made me learn how to be super efficient with everything that I did. And I think I've just been going at that speed and with that efficiency since that time. Um, One of the things I would love if somebody asked that and were describing me is that I also show up authentically. I mean, you talked about that too with the making sure that you are all of your things, you're all your hats. And I want to show up like that in my exam room with my patients too. Like, I genuinely think it's okay to feel like love and trust with my patients. Like that's how I am with my family, I mean, there's certainly limits, but I hope that's what I hope is one of my superpowers. But I think the efficiency and the multitasking is probably what helps with a lot of my leadership stuff.
Yeah, yeah, it certainly does help. But both pieces are very important, and I'm
Yeah,
sure that people say that they see all of those aspects. But thank
yeah,
you for sharing.
of course.
So this podcast, right? The name of this podcast is Lead Change. What does lead change mean to you?
Mm. Yeah, well, it really resonates with me because, Mary, what I was talking about, being a young girl and looking around my community and seeing the people that I looked up to, that I saw making an impact on their community, and affecting change were the physicians. And so going back to this idea that our roles as physicians are leaders, that when you lead, you can affect change. And if we don't recognize that, maybe I'll say this other way. The opportunity there is great, right? So, if you recognize that your role as a physician is looked at as a leader, then you can affect change and you have so much power to do that by what you say yes to, what organizations you're part of, what committees you join, what papers you write. All of that makes a difference, right? People see that, and if they see themselves reflected in the work that you're doing, or being impacted by, or making sure that they're having a seat at that table because you're helping open that door, like it is going to directly affect change. And that just seems so exciting. And why wouldn't we want to do that?
I know exactly. Like the opportunities are tremendous. And so
Uh-huh.
we as physicians have the ability to take advantage of this, but to have an impact. That's exactly what you're saying. Is like we have the opportunity as physicians to have an enormous impact. And it is not meant to be seen as pressure. It's not pressure. It's
Mm-mm.
an opportunity because of the role that we serve in being physicians.
Well, and I would even say it's more than that. It's a responsibility. We talk about this a lot when we're onboarding our new medical students. welcome to the profession. Like, people look at us differently because of the amazing responsibility we have. And so by leading, we are going to affect change, but only us individually get to figure out what that change looks like, if it's change for the good or if it's not.
Yeah, absolutely right. It is. It's a responsibility for sure, like serving in this role, taking great care of patients and just contributing to this profession. Switching gears a little bit. So I love to ask always, right? Have you read any leadership books that you have found particularly impactful or meaningful to you for whatever reason?
Well, I've been trying to keep up with all the reading we've had to do for ELAM.
That's hard.
Those, I know that's probably taken most of my time, but thinking back just like over the years, some that have made a significant impact on how I show up or making it easy on some of the work I have to do are things like Crucial Conversations. If people haven't read that or even done the course, like, that's such a powerful tool. And it doesn't just help you in your leadership role, it helps you at home and with your kids and in your community. So I would say by far that's probably had one of the biggest impacts. I have really enjoyed, well, I'm not reading it, but I'm listening to it, the Women Don't Ask book that had been recommended by ELAM, which really explores, how gender stereotypes from when we're very young influence how women and men lead differently, and which then transpires to negotiations and translates to differences in pay and differences in stature and all of these things, and not only explains the why, but why it would be beneficial if some of that changed and if we'd really step up and ask for what we need. I am really optimistic, though. Working with medical students and young faculty, I do see so many people really standing up for themselves and recognizing that setting boundaries and giving themselves credit for the skill and what they bring to the table seems to be easier than when I was going through it. Mary, I think you're probably younger than me, so maybe you're of that younger group, but I'm just feel so optimistic that folks are feeling empowered to do that differently than maybe some of us did.
Yeah, I that's so great. Those great books are fantastic. Crucial Conversations. I've read only a little bit of it, but I want to read. The whole thing is high on my list to read. And Women Don't Ask, that is such a great book too. And all the points that you made of like how you can benefit by just asking and advocating. And I agree with you completely, though, that medical students and residents, right, that they definitely are more empowered. Like, so I think things are changing, and it's very encouraging. I also thought it was so great the point you brought up about, yes, these are great leadership books, and certainly like we take away those skills and we want to see how we can apply them to different leadership roles, but also the point of how these things, you can also use these tools and these skills in life, in everyday conversations. So it's not only a benefit with regards to a leadership role. And so I encourage anybody saying, well, I don't know if I necessarily would enjoy a leadership book. Like, it will have an impact far reaching, more so than just for a leadership role. So definitely keep track of all these books. There's so many that you should read. Just chip away at it.
Are you keeping track of them from all of your podcasts? I'll have to go back and look at them from your other
there's really like such a
interviewers.
great list of proposed books, and so I encourage anyone, please listen to the episodes. We always talk about the books towards the end of the episode, but just a lot of great recommendations. And then the last question I wanted to ask you, Jewel, is do you have any favorite quotes?
Yes, and I'm glad you let me know that you're going to ask this question because I wanted to look it up. This is a quote from Marianne Williamson, who's an author, and she's been a political candidate before, and it's a little bit long, so maybe I'll just read part of it. But I don't know. Have you heard of this quote, our deepest fear? Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It's our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, and fabulous? Actually, who are you not to be? Your playing small does not serve the world. There's nothing enlightened about shrinking so that other people won't feel insecure around you. It's not just in some of us. It's in everyone. And as we let our own light shine, we unconsciously give other people permission to do the same. as we are liberated from our own fear, our presence automatically liberates others.
Yeah, that is so great. I have heard parts of that. I don't think I've heard the whole quote, but it's so powerful. Right? I love that quote.
Well, and I how I see it is that I think some people feel if you have the capability to do something, right, to present, to lead, some might think, oh, they're so, above themselves, or like the risk. And maybe this is part of the gender thing too, like, oh, I don't want to seem like cocky or whatever, but it's not about that. When you step up and say, yes, I can, you're demonstrating to other people around you that they can as well. So we all have that light inside of us. And the more we, like people like you, Mary, creating this platform to talk about leadership, it's just going to embolden other people to recognize that light in themselves so they can step up and do the same.
That's fantastic, Jewel. Thank you so much for sharing. I just think that is going to resonate with so many people, and hopefully it empowers you guys that are listening, and inspires you to say, like, I can do this. I do have that motivation, that inspiration. I'm going to do it, and don't feel like you have to be small. Just like Jewel was saying, right?
Right.
Like, do it, pursue it, because so many people benefit from you doing that thing, right? From you being dean of the medical school, from serving in this leadership role. So many other people benefit from that. And so it's tremendous. Like, definitely shine your light, right? Take
Shine
advantage.
your light.
Exactly.
I love it. Yeah.
So, Jewel, thank you so much for being on the podcast. I really appreciate you sharing some of your experience and the insight you've gained by serving in these various leadership roles. I know that everyone listening is going to be inspired, motivated, and equipped with so many tools to be an effective leader and person, and to be confident in showing up as themselves, right? Thank you for all that you're doing to advance women's health. I really look forward to continuing to work together over the next several months as part of ELAM. So thank you again.
Mary, thanks for creating this platform in this space. I'm really honored to be interviewed here.
Thank you. Appreciate it. And I look forward to seeing you soon.
Ditto.